So we have a lot to cover. So to get things started, I'm just going to give you a little bit of information about Highland Springs. So we are a behavioral health hospital. We provide inpatient and outpatient services, and we're trying to be different. We're trying to do things a little bit differently by being a little bit more focused on holistic services, by offering art therapy to our patients, pet therapy, music therapy. We do yoga on our units every morning. We make sure that our patients get an opportunity to engage in physical exercise. So we want to make sure that our patients are not only getting their mental health and their addictions treated at our hospital, but also that they're leaving healthier across the board. So we also have 24-hour-a-day, 7-day-a-week assessments. So that means that folks can walk into our hospital at any time, receive an assessment, and get engaged in some treatment services. So wanted to make sure everybody had that information and understood kind of what we do. Any quick questions about Highland Springs? Everybody know who we are? Seen us before, our beautiful facility on Harvard?
It's adult only, right?
That's a great question, yeah. So Renee asked, yes, right now we are focusing just on adults, so the 18 and over population, absolutely. And we provide those services, like I said, inpatient, folks can stay with us while they're getting well, and outpatient services, folks will go home every day and come back for treatment daily, okay? All right, so we're going to talk about mental health and addiction in the workplace. I have a little activity, and I was trying to think about time, but I think it's worth it. So I need 6 people really quickly. Don't be shy. It's not going to be that hard. Come on. Yeah. Now you have to all vote for the Effective Leadership Academy, because she's a volunteer and she has a good heart. Look at her. Yep, okay. All right, great. All right, guys. So, I'm going to give you this. You just need to hold it.
Am I supposed to face it towards the audience? Or
No, towards you right now. I just need you to hold this. Face it. Yeah. Hold this. Hold this. Hold this. Okay. Now show your friend. What's your name, sir?
Mike.
Mike, you have the hardest job up here.
Oh boy.
Yeah. All right. So. Yeah. Okay. So go behind your friends here and look at the signs that they're holding before, so that you can read them. Okay. And so what he's doing right now is he's looking at there are a number of health conditions that he's looking at. And now I want you, Mike, to put them in order of kind of what you think has the greatest prevalence and greatest impact in terms of disability in the workforce. And line them up. You can make everybody line up in a line.
Okay, he's probably, that one's number 1.
Okay, so turn it around. All right, okay.
This guy.
Okay, oh, so cardiovascular. Okay, so we're saying 1, 2. Okay, so diabetes and endocrine diseases. Okay.
You're this one and you. No, reverse.
Oh, he's just putting them in order of height.
No, I'm not. Well, I sort of did, didn't I?
Okay. Okay. All right. So what do you guys think? Is this the most prevalent condition with the most debilitating impact in the workforce? Mental health and addiction. You guys feel like that's number 1? Okay. So cardiovascular, number 2? Okay. So they disagree with you, Mike.
Okay.
All right. Just note it. All right. What do you guys think? Would you switch anything around here? Oh, yes. So this says diabetes or endocrine disease. This says tumors. And this says muscle or skeletal disorders. Okay. All right. So we know that so here's a little facts. We know that 2.5 million Ohioans suffer from mental health and addiction disorders, okay? So do we feel like that stat helps us agree with this? We're still feeling pretty strong about this? Okay, well, it is accurate. Oh, it's not working now. He said, pull the thing out. Oh, it's broken. Man down. Okay, there you go. Okay, flip the slide. Thanks, Kirsten. Yeah. Okay. There you go. Okay, so this is actually, I just did the top 5 for you guys. So it goes number 1, mental health and addiction. Number 2, cardiovascular. Number 3 is neoplasms. That actually is the, yeah, that's abnormal growth in tissues.
So that's the tumors.
Tumors.
Tumors over there, Sandy took off.
Tumor lady, come back. Okay. Number 4 is muscular and skeletal. Oh, perfect. Thank you. Issues. And number 5 is the endocrine diabetes issues. So we actually, yeah. So this is in terms of greatest impact in debilitating factors in the workplace. Okay? Yeah.
But with tumors can cause mental health and addiction.
Sure.
How is she not number 2?
So I am not a tumor expert. So, and this tumors is a broad category, right? We can have tumors that are debilitating in terms of being able to ambulate, walk around. You could have tumors that are in the brain. You could have tumors located on your body. So it's a big, big category. So this is just public health data. But the point of it is, obviously, that Miss Renee DeLuca Dolan is number 1.
That's nice.
We all agree Renee is number 1.
Yeah, okay guys, thank you. You can have a seat. You can take your sheet back with you. Yeah, you can keep them. It's fine. All right, guys, so the point of that is this, because we oftentimes don't think of these issues, mental health and addiction, as being kind of one of the greatest disabilities. Oftentimes when I do this, people never pick, so this is the first time I've done this, and people have picked addiction and mental illness. They always pick cardiovascular. That seems to always be the first one. All right. So when we start talking about specific mental illness and kind of how that lines up, it's depression. Depression is has the greatest impact on our workforce. Okay? And the YLD, that's years lived with disease. And that's just kind of a measure of the burden of the disease on the community and the workforce. But yeah, so it goes depression, anxiety, drug use disorders, alcohol use disorders, and then you can kind of go on down. And we actually will talk through some of these today. We're going to be doing that quickly. You're not going to get a ton of information, but you'll be able to tell me the difference between like bipolar and depression by the time you leave here. Okay? And just another visual. So if this were a room and we were putting these disorders in a room, depression's going to take up the most room, right? So it's just kind of another way to look at the data, just to help you see. Okay? All right, so we know that mental health and addiction has a pretty significant impact in the workplace. Nobody here would probably disagree with that. But what are the specific impacts? The big one is absenteeism, right? So we know that people miss work regularly because of depression. But then there's this presenteeism, where people show up, but they're not necessarily being productive or doing their job. They're not necessarily efficient. Maybe they're kind of sloppy in their work. They're not able to be as effective. That's presenteeism. That means you're there, but you're not necessarily getting the job done, okay? So we clearly see a decrease in productivity. We see increased workman's comp claims. Think about it. Depression, one of the symptoms related, and we'll talk through this, is difficulty with sleep. People aren't sleeping well, depression symptoms get worse, but so does their proneness to accidents. Their decision-making abilities go down. So we see a lot of workman's comp claims that you could connect to an injury, but if we did a root cause analysis, you'd go back and there'd be some impact of mental health, and we know that there's an impact of addiction, right? extended medical leaves, which is a burden on employers, safety issues, and then, you know, when folks are showing up but they're not doing their job, takes a toll on the rest of the staff. So we have morale issues, got turnover issues, and then there's just and there's no way to measure this, but the missed opportunity. The fact that when folks are showing up and they're not able to participate in the workplace and in a total and effective way, we're missing opportunities. We're missing opportunities to be more effective. We're missing good ideas. We just don't even know what we're losing because there's just a lot of missed opportunities. Okay, so we know that the American Disabilities Act requires an organization to make accommodations when there is a disability. The problem is employers oftentimes do not know what to do with an individual with a mental health issue. They don't know how to make an accommodation in the workplace for that person. They don't even know how to talk about it with that person. They don't know how to, you know, approach that person and get the information needed. So I think this is kind of low. I would think it's probably higher, but according to the National Institute on Mental Health, 50% of managers report having no training in managing workers with mental health issues. Has anybody in this room ever gone to a training about how to manage folks with mental health issues? Okay, there's 3 people that raised their hand. 4. Okay, and one of you is an HR person. Anybody else HR? Okay, we definitely should see our HR folks there. All right, so the other thing is our health benefits. Typically, there's the health parity law, yes, that we have to provide coverage for mental health benefits. It doesn't necessarily mean it's adequate coverage. It doesn't necessarily mean that the person will have enough coverage to deal with their mental health or addiction issue. So sometimes those benefits that we have, even if they're there, are lacking, or people can't even afford to utilize their benefit because their co-pays or deductibles are pretty high. So even if we have a benefit, doesn't mean we have access to it. So that's a problem that we're seeing in the workplace too, okay? So the cost. So there's lots of stats about this, but I think it's kind of helpful to break it down. So we've got an estimate of about 105 billion lost in productivity, and that's here in America across the United States. We've got depression resulting in 400 million lost workdays per year across the United States. That's huge. That's just depression. Okay, and then if you take it down to even a little bit more of a local level, I didn't have data for Cuyahoga County, but if you look at just Ohio, we've got, you know, costs at about $6.5 billion a year due to the impact that untreated mental illness has on the workplace. So this is where I want to make sure that we're not developing some unhelpful beliefs or attitudes about mental health, because mental health is a treatable condition. Addiction's a treatable condition. Myself and my colleagues do this work every single day, and we see people recover and we see people get well. The problem is that not everybody who needs treatment gets treatment. Would you guys agree with that? There's a lack of access to care. Okay. All right. So one of the big solutions is what we're doing today. I mean, you have even a small conversation and educate people with just a few facts. I think you guys have a handout on your table today that has some stats on it that Highland Springs shared with you guys. That alone is beneficial, because the moment you start to have some facts that you can go into the world and do your work with, that improves our ability to recognize, identify, and respond appropriately to people who are struggling with mental health and addiction issues. So the big thing you can do, go back to your employers, if you have the opportunity yourself, advocate for you and your staff to be trained in this so that you know how to have these conversations in a helpful, productive, legal way. Because when folks can get linked with care, when they're starting to display some symptoms, they can get better, and they can get better quickly and make a full recovery. So early intervention is key for folks with mental health and addiction. The earlier we can address the issue, the better off that person will be, the better the prognosis, okay? So what is a mental health disorder? It's diagnosable, it's treatable, it is an illness. We oftentimes think of it as very different than medical issues. It is not. Mental health and addiction are brain diseases, okay? And without treatment, we know that it's gonna impair someone's ability to work. We know it's gonna impair people and their ability to engage in social and family relationships. And eventually, untreated mental health and addiction issues gets in the way of that person just even taking care of themselves, completing activities of daily living, taking care of their home, taking care of kind of the basics, kind of all those things that we call adulting. Tough to do if you're not getting treatment for your mental health or addiction. So here's how it shows up in the workplace, okay? You're gonna see people, big red flag, change in behavior, all right? So if you've got somebody who's not normally very social and they're not being social, that's not a change. That's not gonna be overly concerning to me. Some folks just aren't social. But if you've got folks who typically are, and then you start to see a change, they're isolating, they're not having lunch with their coworkers, they're not participating in meetings, they're closing their office door all the time, they're making a lot of complaints about physical health issues because we know that mental health oftentimes leads to a lot of somatic complaints. So aches, pains, inflammation, headaches, neck pain, muscle pain, those kinds of things are very, they co-occur with depression really often, as well as with addiction. When you start to see attendance and time management issues, so people start being less efficient, they stop showing up, they're late, they're asking to leave early, they're not meeting deadlines, all of those are issues. Now, these are also performance issues, right? So I'm saying if somebody were an awesome performer and then suddenly you started to see some of this stuff, there's a reason. People don't just stop performing and doing their job. Most people want to do a good job. So if you start to see some of these things, these are some warning signs. All right? Okay. So when we talk about signs, what we're saying is the external manifestation, like what you're seeing. So when these are signs are things that you can see, someone's appetite, their mood, their sleep, are they irritable? Are they talking about death and dying? When we talk about symptoms, we're talking about kind of what that person experiences internally. So these are things you might not see. You're going to see signs, but you're not going to necessarily see symptoms unless you ask a question or that person kind of decides to share that information with you, because a symptom is an internal experience. So you can't see necessarily, although this guy looks pretty hopeless, but you can't necessarily see hopelessness. You can't necessarily see that a person feels worthless, okay? But they could be experiencing these things. And folks sometimes will be experiencing these things and will not appear like this picture at all, right? Okay, because I'm sure we have examples in our lives of folks that you found out were struggling with a mental health or addiction issue and thought, man, I thought that guy was so happy. Wow, she looked like she really had it together. Like, didn't even know. So sometimes we're not seeing these things, but the person is really feeling those things. So I'm going to give you quick education on some of the most common mental health conditions. Mood disorders. So we know that mood disorders are the most common. This is the category that depression fits into. So a mood disorder is a disturbance in a person's emotional state. They aren't able to, even if things in their life are kind of going okay, they are not able to regulate their mood well. They're having trouble. Something that would normally bring them peace or happiness or joy isn't really doing that. Okay, and it's a really common, I mean, about 10% of folks are going to experience a mood disorder in their lifetime. So we know depression and then we know bipolar. So you guys have all heard the term bipolar, right? People oftentimes assume that bipolar means, a quick switch in mood, going from happy to sad, angry to joyful. That's not quite it. Although there is a lot of mood fluctuations, so really high highs, really low lows. That's what bipolar disorder is. And there's some intricacies there, and I'm not here to teach you how to diagnose, but you guys have it right when you know high highs, low lows, pretty disruptive. When people are in the high high period, They can be engaged in some high-risk behavior, maybe not some good decision-making, maybe some overspending, maybe they're driving too fast, maybe they're making some choices about their life, you know, suddenly quitting school, suddenly, you know, putting their house up for sale, suddenly buying a house, suddenly buying a car. So things will get pretty disrupted in their life during the high periods. And then the low periods where you see a lot of depression, that's when folks are struggling with energy, motivation, you know, feeling sad, feeling hopeless. So bipolar actually is something that people feel is pretty common. They talk about it a lot. It's really not. It's 2.6% of the population, right? So now, will there be people who are having disruption in their mood? Yes, but that doesn't necessarily mean it's bipolar disorder. So depression, we talk about it a lot. People say it's the common cold of mental health, okay? So, and it's true because it is the most common mental health condition, and most folks, you know, will know somebody or themselves will experience depression. So we're pretty touched by it in our everyday lives. But it's a complex condition. It's not as simple as it sounds. It's not just a matter of feeling sad. It's not just a matter of feeling like you want to stay in bed all day or being super tearful. There's a lot more to it, and depression can present differently in men and women and adolescents and kids. And yeah, kids get depressed because people are like, what do kids have to be depressed about? So, okay, depression's not just about your external environment, right? Sure, stressors in our life can absolutely contribute to the development of depression. But we also know that genetics, our physiological makeup, so how our brain is functioning, how our body is functioning. Basically, there are some folks that have a little bit of a predisposition towards depression. Their temperament, their personality is just a little bit more predisposed to potentially developing depression. And we know that gender has an impact. More women experience depression than men. And then, of course, those environmental stressors, a loss, a divorce, a big change in your life. Those are all things that can lead to depression. Okay? Any questions about depression? Because that seems to be one that folks feel like they know a lot about. So anybody want to check like a myth or an idea that they think they have that might not be accurate?
Are women more susceptible to depression, or is it men higher?
Right. So that's a really good question. So what he said, so everybody can hear, is are women actually more susceptible to depression, or do men just hide it better? And so I don't know, but what I know is that more women are diagnosed with depression than not. So we also know that men are less likely to seek help for mental health conditions. So are we just not seeing men when they're depressed? Are we not able to assess that and support and offer treatment and help for men because they're not showing up and knocking on the door and saying, hey, I'm not feeling so good? Maybe. It's not a huge variance between the genders, but we do know that women tend to have more episodes of depression in their lifetime than men. So we can talk about how that, interacts with our societal expectations. We can talk about how that interacts with kind of those gender roles that we see show up in our life. But this is what our stats tell us. But I have lots of questions about those stats too, sir.
Talk about identifying, like the symptoms.
Mm-hmm.
The other part of that is how do you, difficult part is you acknowledge that you have to seek help. That could get real touchy with a coworker
Sure.
or a friend trying to person get
Mm-hmm.
real sensitive.
Yeah, because we know that there's stigma associated with mental health, mental illness and addiction, right? Some folks view it as a weakness in someone's character, or, oh, you just need to learn how to be more positive. You know, how to be more optimistic. Get glass half full, not half empty. And it's not about that, right? That's taking something that's very complex and boiling it down to this really simplistic level that it just then distorts actually what depression is. So, having a conversation with someone, I think it's simple. Be a human. Hey, it looks like you're struggling. I've noticed. Are you okay? Is there anything I can do? Have you ever thought about talking to somebody about it? I mean, well, I am, so I wouldn't say this, but if I was, hey, I'm not a professional, but, I don't know, it might be a good idea to talk to your doctor or see a counselor. A lot of times if people are wonky about it, the big suggestion is, why don't you go talk to your doctor? People a lot of times are a little more comfortable going to see their primary care doctor than going through the whole, calling a counselor, because that feels like, whew, I'm saying something's wrong. So you got to be careful. But I think, yeah, why don't you don't look like you're doing good. What's going on? Looks like you're struggling. Is there anything I can do? And you can sometimes have to ask that a couple times, and that's okay. I'll tell you what, it goes a long way. You think it sounds really simple, and it's like, oh God, I don't have all the answers, and I don't know what words to use, and I'm going to try to remember stuff that Johni said. Don't. Just be a human. Just show that you care. It's just like when we lose someone in our life, right? People will be like, I don't know what to say. Well, there isn't anything to say. Just, I'm sorry. This has to be really hard. I wanted you to know that I'm here for you. That's it. Just keep it simple. Oh, sorry guys. So these probably aren't too surprising, right? That these are like those signs of depression. These aren't probably very surprising, but because we know a little bit about depression in the general population. But so here's kind of here's some signs of depression. And here's some symptoms. So insomnia, huge. I think that sleep disruption is one of the greatest ways in which we see then the mental health issues show up in the workplace. Because without sleep, people will decompensate quickly. We just can't stay well without sleep. So I think that creates a lot of what we see in the workplace. But these are all symptoms. So excessive guilt, feeling, no motivation, no energy. Okay. Anxiety disorder. So we're going to keep on moving and cruising. All right. So anxiety disorders are the second most prevalent of our mental health conditions. And so we've got about 40 million American adults ages 18 and over, which ends up being about 18% of the population with a diagnosed anxiety disorder. Okay. And it's a group of mental illnesses that cause people to feel excessively frightened, distressed, and uneasy. But this is not in situations that we would all feel frightened and uneasy in, These are situations in which the average person's going to be like, might be a little uncomfortable, but I'm okay. I can handle it. It's not going to disrupt my whole day. So these are situations that are just kind of average in terms of stress, but people with anxiety disorders will have a much larger, much bigger response. The most common are panic disorder, obsessive-compulsive disorder, and posttraumatic stress disorder. Now, we all throw around the term OCD. Oh, I'm so OCD. It's how we talk about being organized. That's not it. So I will give you more information on it. But panic disorder. People will also talk about having panic attacks. There's a difference between a panic attack and an anxiety attack. An anxiety attack is like a episode where your anxiety, your nervousness, your stress went up a notch. A panic attack is different. It's actually uncontrollable panic response that you're not necessarily being threatened. You're not necessarily able to connect it back to something stressful that just happened. If you have a fear of public speaking, somebody might have a little episode of anxiety before they get up and talk, right? Might be like, oh man, kind of warm, my heart's beating. Okay, that's not a panic attack. A panic attack is when folks are feeling, they might feel sweaty, they might feel cold or hot, but they also have some really unhelpful thoughts, which is like, I'm going crazy, I'm losing my mind, the world is about to end. It's pretty irrational thinking that goes with those kind of physical symptoms of the heart pounding and the sweatiness and the numbness and the nausea. But people really, really feel like they're losing control during a panic attack. It's a pretty scary experience, especially when you're like, I don't know, I was fine. And the next thing I knew, I wasn't. And so that's what's different about panic disorder. I absolutely think that probably everybody in here has probably had an episode of anxiety where they were like, oh man, they felt fear, they felt intense stress, they had their heart pounding, they felt out of breath, but not necessarily a panic attack, okay? Obsessive-compulsive disorder. So this is not just being like really excessively neat or really interested in keeping things clean. This is about having two components. There's a cognitive, so a thought component, as well as a behavior component. This is people having thoughts that are intrusive, meaning they don't want to think them, they don't want to be focused on this, but the thoughts keep coming into their head, and they typically need to engage in some sort of behavior in order to take those thoughts down a couple notches so they can function, okay? So that makes sense. They're intrusive, those thoughts are irrational, they don't necessarily make sense, there's not necessarily evidence to support them. You know, knowing that you turned the gas off on the stove but needing to go back and check 16 times before you leave for work is a problem. And knowing like I saw it, I know I did it, I know I turned it off, but I have to go check again, I have to go check. We will oftentimes see people with obsessive-compulsive disorder, how it shows up in work is often with attendance issues. They're often late because they lose track of time because the disorder becomes so difficult to manage that the rest of their life kind of falls apart. They end up being late, they lose track of time, they can't get things done because they're engaged in their compulsions to kind of ease some of their obsessive thoughts. Does that make sense? Any questions here? Now you can go home and like tell people obsessive-compulsive disorder is not, like we're using the term inappropriately. It's actually a really debilitating condition. Okay, and post-traumatic stress disorder, this is what we think of when people are coming back from war. Okay, true. That's how we learned all about post-traumatic stress disorder when we had war veterans coming back from combat. But PTSD is actually, it's an anxiety disorder, and people have this experience after they've been exposed to trauma. Not everybody exposed to trauma will develop post-traumatic stress disorder. In fact, most people won't. Most of us, the first 30 days after experiencing a traumatic event, will have a little creep in some of these symptoms. Maybe we're like thinking about what we saw, like, I don't know, if you witnessed a car accident. Maybe you're thinking about it a lot, and every time you're in the car, you're a little more tense. Or maybe, you know, when you're going to lay down at night, you're like, kind of keeps flashing back into your mind. Maybe you, you know, are kind of avoiding driving, like, I had a road trip planned, but I don't think I'm going to go do that. I'll just stay home this weekend. Those are all kind of normal reactions after you experience a traumatic or stressful event. Normal because you just experienced something difficult. After about 30 days, most people, the symptoms will go down and your functioning will go right back up to where it was. That's what most people experience. But folks who don't, oftentimes go on to develop post-traumatic stress disorder, where they're impaired and impacted by that traumatic event, and it starts to show up in all areas of their life and create really challenging symptoms like these listed here. So nightmares, kind of being easily startled, kind of feeling like you have to be high on alert at all times, looking for danger, difficulty concentrating, difficulty sleeping, all of those things, okay? And then this last category of mental health that we're going to talk about is thought disorders. And these are things that are like what we think of as really chronic, severe mental illness. So like schizophrenia, that's the most common thought disorder. It affects about 1.1% of the population. So this is when people are having hallucinations, which are when you see, hear, taste, smell, feel things that other people don't. So things that are not real. And delusions are fixed beliefs that are not based in reality. So a belief system that, I have a direct connection to the President of the United States. He talks to me through NPR every morning. I know he's sending me messages and I have to, document in code what he said. Yeah. Oh wait, yeah, Twitter, not NPR. That was a bad example. So really, I'm gonna write down not to use that one again. So thought disorders include hallucinations and delusions and really disorganized, kind of odd behavior. An individual will just have a lot of difficulty functioning without treatment. Now, folks that get treatment can function well. People with schizophrenia can have happy, healthy lives as long as they have, continued treatment. Okay, so questions about mental health. Anything you got for me before we move on to addiction and we don't have long? That's okay.
So what about, I don't know if it's called multiple personalities.
Oh, yeah. That is in its own very own category, and it's called Dissociative Identity Disorder. It's incredibly rare and also disputed among the mental health community as to whether or not it's real. Been disputed for years and years, probably will continue to be disputed for years and years, but it's in a category of dissociative disorders, which means like not being connected to your body, not being connected to time and place. Yeah, it's very, very interesting, but yeah, it's very, very rare. Yeah. Yes?
Do you have any comment about those individuals whose depression may be more chronic than acute, where it's just part of who they are and part of their life?
Sure. There are folks who will have depression across the course of their lifespan. It will vary. There could be times when they're doing better or worse. And then there's folks who are going to have depression for a small period of time. Maybe a few weeks, maybe a few months, maybe a few years, or maybe have an episode and then 8 years later have another episode. So there's a difference with depression. You'll see that it can be chronic or it can just be kind of a one-time deal. And for folks who have long-term chronic depression, we see changes in the brain. So the brain starts to react and respond differently to their environment. And so folks with long-term depression, especially if they're not getting treatment for it, will start to see some atrophy in the brain where, around decision-making, problem-solving, critical thinking skills, because depression really takes a toll on how we see ourselves, others, in the world. We see ourselves, others, in the world through a very negative, unhelpful light, and sometimes not even in a reality-based way. So it will definitely impact people and how they relate to others and kind of how they navigate the world, how they show up in the world, especially if they've got the chronic condition and if they haven't had treatment across their life. Yes? Yes. Oh, sorry.
What was that number you said, 2.5 million on highway?
Oh, goodness. Yes, 2.5 million.
So how does that break down? Is it like
Oh, geez.
5 people, 2 out of 10?
I can answer that. 1 in 4 individuals suffers with mental illness. 1 in 4. So everybody, this table, you could be safe. I'm not sure, but this table, definitely not. This one right up front. Okay. All right, just want to keep moving. I want to make sure we talk about substance use. Really quickly, one question. That's a mental health disorder. It's not a common mental health disorder. So we only just talked through the common ones because believe me, there's lots and lots I did not share with you today. But borderline personality disorder is a chronic mental health condition that disrupts a person's ability to kind of regulate their emotions, their ability to navigate relationships effectively and in a healthy way. It co-occurs pretty regularly with substance use as well as with depression. And oftentimes is diagnosed when people have survived childhood trauma. Okay, yeah. One last question. I said that before, but I'm going to be firm this time. I don't know. I haven't assessed you. Okay, so substance use disorders. So we all know, I'm sure we all know what alcoholism is. I'm sure we all know what drug use looks like. We know that it's disruptive to people and their lives and their families, and it can really be debilitating. What it means, though, is people who have an addiction they are using at an increased rate. They need more of that substance to get the same effect So 4 beers used to get you buzzed, now you need 7, that kind of thing. You develop a tolerance physiologically. You have withdrawal symptoms if you don't use, all the way from just feeling kind of cranky and having a headache to full-blown, really dangerous physical symptoms that create a lot of discomfort and illness. Most people with a drug or alcohol problem have attempted to quit using multiple times. That's not the problem. Attempting to quit is not it. It's staying quit, you know? So being able to maintain that. Folks end up saying like, oh man, I went to the bar and I was gonna have 2 drinks with a friend. Next thing I know, I was, 8 or 10 cocktails and I can't walk out and, and the bartender's taking my keys. So folks who have, that's not a one-time event, that's like a common event for them. They use a lot of time and energy and resources, money to get the drug, recover from the drug or the alcohol, and it gets in the way of their lives. It really disrupts their life, causes them negative consequences, okay? All right, so the cost is pretty huge of substance use here. So about 197 billion each year to employers. And 1 out of 5 worksite deaths show evidence of substance use being a part of the problem, what led to the death. And somebody who's using substances are 10 times more likely to miss work. 10 times more likely, okay? And 75% of people who are using illicit drugs are in our workforce. So these are not our people who are categorized as lazy, sitting at home collecting government benefits. No, these people are working next to us. These people are in our workforce. So, and substance use does not discriminate. This is not a disease for poor folks. This isn't a disease it doesn't discriminate. There were a lot of misconceptions about what it means to have a drug or alcohol problem. Hopefully, if anything, from this opiate crisis that we're experiencing, we've learned that it doesn't matter who you are. It doesn't matter if you live in Bay Village. It doesn't matter. It doesn't matter if you live in Rocky River. You and your family are susceptible to this disease. Not to be a big downer, but all right. So alcohol use, and we'll go into a little bit of opiate discussion real quick. But we know that it causes about 88,000 deaths per year. We know folks are binge drinking a whole lot. And binge drinking means that you're having an average of 8 drinks at a time. People do that regularly, and they don't necessarily have an addiction. They're just engaging in substance abuse, but they're not necessarily addicted. So they don't physiologically have withdrawal symptoms if they stop drinking, but it does get in the way. It does cause them problems in their life. Okay. So opiates and opioids, there's a little bit of a difference. I'd rather run through and just talk about the crisis really quickly. Yesterday on NPR, I heard 150 deaths per day in the U.S. right now. That's what we're having. Cuyahoga County says we're on pace to see 775 deaths in 2017 of unintended overdoses. These are not people attempting to kill themselves by using heroin or opiates. These are people who were just trying to get high because they're addicted and they didn't mean to die, and they did. Okay. It's gone up pretty extensively. So you can see that we, in 2016, had drug overdoses that caused deaths in 4,050 Ohio residents across the state. That's across the entire state of Ohio, right? Cuyahoga County, unfortunately, is one of the leaders in those deaths. You guys have seen the articles, right? Morgues were running out of space to store bodies. Okay? So, what questions do you have about drug and alcohol? Yes, absolutely. So they've done brain research that says that, so this is kind of one of my favorite ones. If you have a parent who had an addiction and they hook your brain up to some monitoring stuff and your body up to some monitoring stuff to test out your systems, like how much you're salivating, how high your heart rate goes, what are your respirations like. Even if you don't have an addiction or even a problem with substance use, but you have a parent, your body responds in a much more intense, strong, craving-like way just by seeing visual images of drugs or alcohol if you have a parent who had an addiction. So yes, there's a genetic component. Your brain will be predisposed if you have a parent or relative with an addiction. Absolutely.
Thank you, this is very helpful. Now that we know all of this as employers, how do we help to manage this with employees?
Yep, absolutely. So how many of you have a drug-free safety program in place at your workplace? Good, good, good. So you engage in like drug testing upon hire, randomized drug testing. Okay, that's a good thing because that will help keep your workplace safe, but it also identifies folks who are struggling. How many of you have an employee assistance program? Okay, good. Because when you start to see these signs and symptoms, whether mental health or addiction, you should be connecting your employees to the employee assistance program. You should be making that information available at all times, put it everywhere. I used to do employee assistance work for years. I would tell employers, stick it in the bathroom. Because when they're in there by themselves, no one's going to see them grab the pamphlet or the flyer, because sometimes people are embarrassed. Don't store all of the employee assistance materials in the HR office, so you have to go on to HR and say, hey there, just asking for a friend. People feel awkward, they feel weird about it. So you got to make sure that those resources are available. So if you don't have those resources, it gets tricky because you can't just ask people questions about their health, right, as an employer. So you've got to consult with an HR, expert, a lawyer, before you kind of dive into this in the workplace. In your personal life, you can dive into it, just be a human. But in the workplace, you got to be really careful. You can do education for folks. You can make sure that they know that there's help available. You can celebrate things like Mental Health Awareness Month in the workplace and hang up flyers and tell people about NAMI, which is National Alliance for Mental Illness, huge national organization. Every community has a local chapter. Ours is a pretty awesome one here in Cuyahoga County. So you can make resources available so people know where to turn and where to go to for help. Okay? Yes?
I have for a ringer. Mine is addiction, but it's not that. It's the worst one.
Okay.
Addiction is addiction. And I guess my question to you, don't you find it most difficult as being raised because you can stop using drugs, you can stop drinking, you can stop smoking, you cannot stop eating.
Sure. So eating disorders as a whole are a category of really difficult to treat complex mental illness and physical health conditions. So you cannot treat an eating disorder without treating the physical health component of it. So it's a pretty complex treatment process, requires specialists, because yes, you can't live life without kind of having to navigate food. So it is a really complex condition to treat. All right. So we talked about drug-free safety programs and employee assistance programs. Okay, so here's my contact information. If you have any additional, and I have cards with me too, if you have any questions, please feel free to reach out to me. I'm okay to, you can always run a question by me. Email's really the best way to get in touch with me. Yeah, did I make my email address wrong? Okay, I have cards. It's a typo. Do not write that down. It is inaccurate. It's fine, I have a lot of cards. So, what did I do? Did I spell my own name wrong? Oh, no, okay. Because that could happen. Okay, so I have cards. I'll just set them up here. People can grab them. And just let me know if you've got questions. I'm happy to field questions, Okay.
Well, in the beginning, you said that you do walk-in assessments and that you do all assessments 24 hours a day. So how do you handle assessments when somebody comes in and they don't have the kind of insurance that you take ahead of time? Do you take everybody? Or, how does it work?
Well, if a person shows up on our door, we're obligated to serve them. And then if we aren't the appropriate place, regardless of payment, somebody comes in with a really really difficult to treat eating disorder, we might not be the best place for them in that moment. We will assess who is the best place. We will connect people with the help that they need. We'll figure it out. But once you're in our door, we'll take care of you and we'll figure it out from there.
And I also just want to tell you that I just think you are a real gem.
Matt, my boss is at that table right there. He's turning around. Please tell him I have a review coming up. Oh, thanks. Oh, thank you. Thank you.